just said I'd record a few bits of information regarding some of the queries that you have mentioned to me by email or WhatsApp. So I just thought I'd deal with the neck. Okay, this question comes up quite a bit, and a lot of clients come into Pilates and it actually puts them off. You find that a lot of people don't come back to doing Pilates because their neck hurts, because their upper back hurts, and so I really want to try and explain to you why that is the case, and not to let it put you off, because it sometimes can be a bit of a good thing, but at the same time we've got to try and work through it and try and prevent it and make it better than just ignore it and just say, right, that's it, not doing any more Pilates because it's hurting too much. So what I want you to do, I want to introduce you to my spine. Okay, now I bought this spine ages ago and I've really never used it because I've never really had cause to. So here's my spine. Okay, you have your pelvis. I'm going to talk in fairly simple terms. So here's your pelvis. Okay, now when I say to you about sit bones, there's your sit bones. Okay, so they're very narrow, as you can see. Obviously they're slightly different on everybody, and they're narrower on a man than they are on a woman. Okay, because of obviously the difference in our pelvises. There's your sit bones. Okay, so your hip bones is here. So that's where, in this area here, is where your socket, ball and socket joint will go in. So that's your femur. Your femur will come in here. So your ball and socket joint here, and your bone comes down here. Okay. So there's your hip bone, and there's your sit bone. There's not that much difference, but they are a lot narrower, as you can see. Okay. Your sacrum. Okay. Part of the spine here. Coccyx down at the bottom. Okay. Then your sacrum. Then you've got your lumbar part of the spine. Now the lumbar part of the spine forms 5 parts of the spine. Okay. When I talk to you about imprinting the spine, what we're trying to do is imprint the lumbar area of the spine. So what we're trying to do is tilt the pelvis, and as we tilt the pelvis towards you, you imprint the spine on the floor. Okay. So again, it's creating that flexibility through that area. Now we tend to have lordosis. Okay, and that's a natural curvature of the spine, but some of us have more lordosis than others. So lordosis would be this. Okay, so you're really there. Okay. Now, anybody that's got kyphosis, anyone's got sort of a humped back or something similar, that's that position. So there's too much curvature in a flexed position rather than an extended position. Okay. So there's our spine. The next set of bones, okay, vertebra, is your thoracic area. So this is the area that we're trying to create the C-curve through. Okay, whether it be a flexion, an extension, or laterally, okay, so at the side, okay, so at the side it's still, as you're taking it sideways, you're creating that space down the edges, down the side here, okay, and I don't want you to forget that there is a front of the spine, okay, so when I say to you we're doing our swans and we're doing our swimming, and we're opening up the front area of the spine as well, okay, we're stretching, there are still ligaments and tendons around the front area of the spine, okay, so we're stretching out those areas as well, so it's you know, there's front, back and side, even though we only really get to see this when we focus on the spine and we see it in pictures and we see it, you know, when we picture what our spine looks like, we feel it, you feel the knobbly bits, but you don't actually realise that there's another part of the spine on the inside of the body as well. Okay, so we're wanting to stretch that area out too. So the thoracic area, which goes from about there up to 1, 2, 3, there, okay. There's your thoracic area here, okay. Now that's where it goes into a little bit of kyphosis, so it starts to flex, okay. So what we're trying to do is trying to create that flexion a little bit more with that C-curve. So we're dropping that chin down, so there's the back of the head, there's the back of the skull, okay, the occipital. So we're dropping that chin down towards the chest. So this area, and this doesn't stretch very easily, okay, as you can see. That's coming down here, okay, and then what we're trying to do is create that curvature through this area of the spine here. Okay, so why do we get pain in the neck? There are 5 reasons, well, it's more than 5 reasons, but generally there are 5 reasons for there being a bit of a pain in the neck. Okay, and the first one is the fact that your head weighs about 4 to 5 kilograms. Okay, it's quite heavy. You've got very small muscles that sit in the back of the neck. Okay, obviously you've got ones in the front as well. But when you're on your back and you're in your crook position and you're having to drop the chin down and having to lift up, if your head goes over the back, so even if you were standing, if you just tipped your head back, the weight of your head having to go through those neck muscles and through the spine is quite heavy, okay, and it puts a lot of pressure on those muscles as well as stretching through the front of the neck as well, okay. It's quite a heavy weight, and that's basically what you're doing when you're laying down. Okay. Normally, when you're laying down in bed, you've got support, but because we're having to lift the head up and we're holding it here, what we want to try and do is try and keep the ears in front of the shoulders. Okay, so that we're not taking any of that weight through the back of the neck. So the idea is, you know, just remember that we need to think about tucking the chin in. Okay, and most of the time it's because we have the weak muscles. We have weak tummy muscles as well. We have weak abdominals because it's the abdominals that are actually rolling everything forward. So we're shortening this space here from that rib cage to the pelvis. We're shortening that space, okay, to lift the upper body up, okay. So if you have weak abdominals and you've got weak neck muscles, then that's a culmination of part of the reason why the neck hurts quite so much. The next one is the amount of repetitions that you do. Okay, it might be that you're working to the point where you are fatiguing quite quickly. You're doing too many repetitions. I'd rather you do 2 or 3 really, really good exercises than to do 10 really, really bad ones. So the key with Pilates is to be able to perform something well without pain and within that relaxed position, within that alignment, within that precision. We're looking at precision, okay? So I'd rather you do 2 or 3 than to do 10. So if I ask you to do 10, or if we're doing 100 and you find that doing 100 is too much and you can't do 100 pulses, just do 50. Or have a rest and then start again, okay? So it's really, really important that you work to your ability, okay? Don't perform too many repetitions. If it means losing your posture, if it means losing the alignment and your positioning, then you're not performing at your best ability and you're not going to improve, okay? The next reason for there being pain in the neck, okay, is the lack of flexibility through that thoracic area. So that centre part of the spine that I was talking about, the thoracic area, there's 12 of them, okay, either rotation, so turning it, either the lateral bend, okay, or the flexion or the extension, okay. So really you need to improve that flexibility, so that's another part of the reason, okay. And then you've also got the fact that you may be breathing, okay, into your belly, all right? So instead of breathing into the rib cage and breathing laterally, okay, and allowing the rib cage to expand out and backwards, you're breathing into the belly. So again, you're losing that control, you're losing that centering, okay. So let's think about what we can do to improve, okay. So first of all, we need to think about our the strength, okay. So think about the strength through the neck. Think about the strength through the tummy, okay. Think about our posture as well. So there are exercises that we can do to increase and improve the tummy strength and increase our neck strength as well. When it comes to repetitions, again, work at your ability. When you feel fatigued, if you feel tired, if you lose that posture, if you lose that the alignment, as I said, stop, okay. Reset yourself. Take a few moments to get back into position and then start again, okay? I tend to give you lots of opportunity to continue that exercise for a fair amount of time. So if you find that you're doing too many, have a rest and then restart it, okay? The key also is to relax. I also find that as you're holding that position, people tend to shrug their shoulders, they bring their shoulders up, so it's very key to try and slide the shoulder blades down the back of the body. So just focus on the shoulder blades, putting the shoulders away from the ears so we're not tensing up through the trapezius muscle. As soon as we start to tense up here, everything tenses up and then you start losing your breath control as well. So it's very key to think about to think about relaxation. Okay, so in a moment what I'm going to do is I'm going to show you some flexibility exercises that you can do to help with your flexibility through the thoracic area of the spine. So I'm going to do that in a moment. Okay, so that's key, is to work on that flexibility, to allow the thoracic area of the spine to create that C-curve, to allow the movement. Because a lot of the time we get very stuck, we get very tight, we've got very tight shoulders, we have very tight necks because of our work, because of our posture. So the key is to try and open up that midsection of the spine in order to create more flexibility, more relaxation, allow the muscles to lengthen and allow better posture as well, okay? And then also we've got to think about breathing. So when you breathe, think about breathing into that rib cage. Think about breathing outwards and into the back of the room, okay, rather than breathing through the belly, so trying to lift the belly up. If we pull that belly in, if you're constantly just tensing that belly button, or tensing the muscles in the tummy just ever so slightly all the time, and you're really working those muscles without really thinking about it, but we're not tiring them out completely. So you're working at a fairly low level. But if you focus on that, and if you find that when you breathe in, you're starting to relax the tummy muscles, then that's when you're starting to belly breathe. So what we want to do is focus on breathing outwards, so allowing the rib cage to expand. Okay, so even if it means when you perform an exercise for the first time, or it's the first time, just focus on the breath. Focus on where your rib cage is in relation to the rest of the exercise, and how you're going to breathe in order to perform that exercise a little bit better. Okay, so hopefully that's helped a little bit. Okay, what I'm going to do, I will stop this part of the video now, and then I will show you some of the exercises in a moment. Okay, so I'm hoping that's helped a little bit, and you've understood a little bit more about how and why the neck might hurt whilst you're performing some of the exercises. Stick at it. It's really important you stick at it, but again, very important that you give yourself a bit of a breather, give yourself a break. Okay, don't work too hard, don't try too hard. Okay, don't try and make it work. It will work if you relax and allow the body just to sort of settle into each of the moves, okay, and work at your own ability. All right, thanks very much for watching, and yes.